Hi, I'm Kathleen Sebelius. I'm the Secretary of Health and Human Services. And I used to be a Kansas Insurance Commissioner. So I'm going to talk this morning a little bit about rate review, one of the new features of the Affordable Care Act, and talk a little bit about why that's so helpful to consumers across the country. So I'm here with the whiteboard, and we have a chart that shows you what's happened over the last 10 years. CPI is the Consumer Price Index, the average price increase for goods and services, for the gym shoes you buy for your kids or the groceries you pay for at the grocery store. And over the last 10 years, things have gotten more expensive, almost a 30% increase on consumer goods. But that's really a very different picture in the health insurance market. So while you've paid 30% more for a variety of goods, insurance costs have gone way up, have gone up 131%, which is very difficult for lots of families. It prices people out of the market. They've assumed more of those costs out of their own pocket, and year in and year out, they are paying more and getting less in the insurance markets. And now I want to show you what's happened in 3 specific states and why this new rule is so important. So let's flip the whiteboard. First of all, let's start with some basic facts. Every state in the country has an insurance commissioner whose job it is to make sure companies are solvent so they can pay claims, but also to protect consumers. So looking at the rates that insurance companies want to charge and looking at justifications for those rates. Now, a lot of states do a very good job with a thorough review, hiring experts to look at the numbers from the insurance companies, often having hearings, making sure that what the company wants to charge is justified. Other states have laws that don't provide that kind of close scrutiny. So the Affordable Care Act does a couple of things. First, we have new resources that have gone to states to encourage state insurance commissioners to hire more staff, to get more authority, to use the authority they have to actually protect their consumers. But also it gives the Department of Health and Human Services some new ability to provide an extra look at higher rates, to shine a bright light on what's going on, and to make sure that consumers are protected. Companies will have to put on their websites and on our website what the justification is for rates. For the first time, consumers will be able to see how their company compares to other companies in their own state or even around the country. So let me give you a practical example of why rate review is so important and how it matters to you and your family. Let's start with the state of Massachusetts. Insurance companies came in to Massachusetts and proposed a 26% rate increase last year. That's a whopping increase. And what happened in that state is the insurance commissioner took a hard look at it. They brought their resources to bear. They questioned the company. And what ended up in Massachusetts was not a 26% increase, but a 13% increase. So they cut in half the increases for Massachusetts consumers. In the state of Connecticut, the Connecticut Insurance Commissioner actually allowed for a 20% increase. It was announced across the state, and there was such an outcry that actually the Insurance Commissioner has resigned, and this rate increase has been withdrawn altogether. My guess is that the companies are likely to come back with an additional proposal, but I can pretty well guarantee you that that proposal will be much more careful in the future about what kind of rates are really justified. And finally, the state of California. Last year, one of the issues that actually was part of the final debate around the passage of the Affordable Care Act was this astronomical, almost 40% rate increase, which was proposed in the state of California, and consumers across that state had gotten notices that their individual insurance policies were about to go up 40%. Again, there was an enormous outcry. The insurance commissioner in California heard that outcry, set up his own rate review process, brought in experts, looked at the rates, and in California, that almost 40% increase was cut in half to 20%. So in each of these cases, rate review made a huge difference for consumers. So rate review done at the state level is very effective, and we now have the tools to actually declare rates to be unreasonable. Anything over 10%, which would have been in all three of these states, the Department of Health and Human Services will be able to review, to get the justification for, to publish on our website, to have the companies publish on their website, and to make sure that if consumers in America see a rate increase, that it's based on medical costs increasing.